Good evening and welcome to The Square. Tonight is a very interesting discussion where we focus on the 2019 Ministerial Order on Abortion in Rwanda. Under this topic, we're going to look at a couple of things, in particular, this ministerial order. And just, for viewers' information, this is a ministerial order that was passed on in April of 2019. And under this ministerial order, abortions can be performed in specific cases. And I'll just name them in terms of rape, in terms of forced marriage, in terms of incest, committed with a person to the second degree of kinship, if there's a health risk to the woman or the fetus, or in cases where the pregnant person is a child under 18 years old. These are the grounds in which this ministerial order was passed, and we're here to examine, amongst other things, the journey of implementation of this order, the challenges faced, as well as the way forward. I'm very happy to welcome our three guests tonight with us, and I'll start with our guests who are here in the studio. First is Dr. Aphrodis Kagaba, who is the Executive Director of HDI Health Development Initiative Rwanda. Dr. Aphrodis Kagaba, great to have you on the square. I know it's not your first or second time. It's always a pleasure to have you with us. Great. Also joining us is Chantal Umuhoza. I think it's her first time on the square. She, amongst other things, she's here in a capacity as a feminist activist. Chantal, it's an honor to have you on the square. Also joining us, I'm very happy to welcome again Dr. Eugene Goga, who is the president of the Rwanda Society for Obstetricians and Gynecologists. Dr. Ngoga, it's great to have you on the show.
Thank you very much for inviting me.
Great. I know last time you were here, we had a very interesting topic on surrogacy, and now it seems we only invite you for the hot, the hot topics, but it's an honor to have you here. Thank you. Also joining us, as always, is resident panelist Charles Haba, looking very fresh in lime green from Uzi Collections. Charles, always an honor to have you on the show.
I almost wore a shirt like yours.
I know. I'm good. Yeah, keeping it made in Rwanda. My name's Dan Mpisi, host of The Square. As always, before we kick off, we have some midweek highlights from The Square resident panelists. Charles, I don't know if there's something you want to share. It's been a week full of hot topics.
There's quite a lot happening, but just when we thought we had this COVID thing in check, and we thought we're going to have a good Christmas and good New Year, and travel all over the world, and people come into the country, and us going everywhere, and Christmas and New Year, and then you have a new one. It had too many digits, and then they coined the word for it, Omicron, and we were being told it mutates in many different ways, but I just don't know where we have two doctors in the room today. I don't know where we're going with this whole. In Kenya, they say we can afford to laugh at it, but it's extremely concerning because you aren't too sure how to plan with this whole COVID drama.
I know.
Yeah.
I can't agree with you more. It's just terrible but it also shows us that this pandemic is here to stay. We just need to know how to adapt and plan forward and keep adhering to the COVID-19 guidelines.
Yes.
Yeah. As always, we usually have Brenna Namata, who's on the show. Unfortunately, she's not here. Really going to miss on such an important topic. I know she's very passionate and has a lot to say on elements we're going to discuss tonight. So the first question, I would like you to just go to Dr. Aphrodis Kagaba. But before we do, actually, I would like us to read a couple of tweets, just to put into perspective what some people are thinking ahead of this show. And the first tweet, if you could have that on our screens, is from someone called Paul. And Paul says, the ministerial order should have clarified that the doctor has the right to not perform abortion. After all, our constitution provided inalienable rights to own beliefs. So he thinks there's a loophole where doctors should have a right to say, no, we don't want to perform an abortion. The second tweet coming in is from Frank Kigenza, and he says that abortion will always spew a very controversial ethical and legal debate between, one, the woman's bodily autonomy, and two, when does life begin, or the embryo's right to life. These are a couple of tweets before we kick off the show, and I'd just like to tell our viewers to keep the tweets coming using hashtag #TheSquareRW that we'll definitely be reading on later on in the show. My first question is to Dr. Kagaba. Dr. Aflodis Kagaba, yes, who's here on behalf of Health Development Initiative. And, you know, as I said earlier on, this is a ministerial order on abortion that was introduced in 2019. And I know that HDI has been very instrumental in sensitizing communities across the country when it comes to this order. If you could just give us a snapshot of how this sensitization and reception of this order has been, especially when it comes to ensuring safe abortions or just putting out this information there to Rwandan communities.
Yeah, thank you so much, Diana. As you said, this order was approved by Cabinet in 2019, and it came from a process that had been going on since 2009 when our penal code was being reviewed, with the initial changes being adopted in 2012, but with some barriers like going through the court that was dropped again further to the advocacy efforts in 2018 when the law determining penalties and offences in general was reviewed. So we are happy to see that since 2019, when the ministerial order was adopted, we've been trying to raise awareness to ensure that the providers, the healthcare providers, are aware of the ministerial order, but also more especially the women and girls who need safe abortion services are aware of the ministerial order. And as of now, we've been able to reach all the 30 districts, and what we did initially was to target the initial key players. So we've been able to meet in every district about 600 to 800 people, targeting potential women who are at risk. We've met teen mothers, we've met women involved in sex work, we met women leaders, those who are in positions where they can share with other women and networks. We've met youth leaders. We've met healthcare providers, at least inviting every health facility to be aware of the order, and law enforcement agents across the whole country. So what we have seen is that increasingly people are getting to be aware, but certainly there's still a lot of work that needs to be done. In these meetings, I mean, the acceptability has been very diverse. I mean, when you go to communities, you find people who are religious, who think the ministerial order is allowing what's not acceptable. We've had very interesting debates. But the most important thing here to retain is that when a woman or a girl decides to terminate pregnancy, nothing will stand in her way. What ends up happening is that she will go to unsafe means, which has its own consequences, as we keep discussing. So we've had interesting sensitization. We are seeing increase in demand of services. We've seen women who are starting to ask. We are seeing health facilities that are starting to provide safe abortion services. And then what we have to intensify is to take that now to communities, engage community health workers, engage religious leaders, engage media to keep raising awareness on the ministerial order so that people are aware that if you need this service, you can go to a health facility instead of going to unsafe, crude, other options that may end up taking their lives.
Thank you, Dr. Kagaba. I think you mentioned something very important, that you know, if a woman wants to terminate a pregnancy, there's nothing that will stop her. And often cases, they resort to methods that are just often fatal. So I find that very interesting, you know, as someone who's worked in these communities, who's seen this firsthand across the country. We'll definitely be coming to some of your key points. The next question I have, and I want to, you know, talk to all the doctors first before we go to Chantal and hear from the rest of the panel, including Charles, is to do with implementation of this order within the medical community. And a report published by the Ministry of Health in 2019 indicated that the total number of registered medical doctors in Rwanda is 1,648. I'm sure it's risen since then. And usually general practitioners and specialists are only available in district, referral, and national hospitals. So this question to you, Dr. Goga, Eugene, on behalf of the Rwandan Society of Obstetricians and Gynecologists, of course, when it comes to, you know, the specialty with which you're here representing today, who are in charge of ensuring safe abortions, this number significantly becomes much lower. And when it comes to, you know, performing safe abortions, especially with regards to the grounds that the ministerial order has put forward, it becomes a challenge. So, you know, just give us an idea, a snapshot. How you know, when women and girls are coming forward, you know, asking for these services, and there's issues with the number, you know, the ratio of these specialized doctors to perform these abortions, what is the implementation process like? What has been the uptake and the reality on the ground, so to speak?
Yeah, thank you very much for that question. I think, first of all, as health professionals, we are very happy that, or we are satisfied that we have at least a legal opportunity to support this type of situations, because before 2012 we didn't have this, and it was very difficult to come to the rescue or to come to the help of these patients. And I think these 5 conditions, they look really having a lot of meaning. So it means for us as doctors, our role is to help the patients to feel much better. But as you said, if you look at the number of gynecologists, we are still very low, because at the moment we can say that we are around, let us say, like 95 gynecologists in the country.
In the whole of Rwanda?
Yeah. So,
wow.
And we think that we've improved, because in the past 10 years, I remember when we started even this association, so we were like 10 or 12. So now the number has increased. But in front of this situation, it's very difficult to say that we'll satisfy every person. But the good thing here that the health system is so well organized that the referral system is there. And if you look at the provision of abortion, it depends at which stage the pregnancy has gone. Like in early stage, it's possible that you can also transfer knowledge to those people who can do that. Let us say if you get a general practitioner, you know that general practitioners can perform C-section. So they do it in a district hospital, and I believe this C-section is much more difficult than performing a safe abortion. So all is depend on the training which is given, and this is what we've been doing since this law has been passed, to try to train more and more, to educate. And some of the termination of pregnancy can be done just with medication. So you don't have to do any surgical procedure for that. So of course, as the pregnancy is moving towards advanced stage, then it's becoming more difficult. And that's must be done by a specialized person who is a gynecologist, and through the referral system, this person, these patients can go to where she can get this kind of treatment. So I don't think it's a big problem because of the number. It's just up to us to know at what stage we can allow other professionals to come in and to give them guidance when to transfer the patients to a more specialized care. I think if you look at one of the conditions here, when they talk about health of the pregnant person or the fetus, this thing must be judged by someone who knows, because any doctor cannot know this fetus is in danger or the mother's condition is in danger. So we need someone who has been trained to understand that and take a decision. But for other reasons, I think it's possible that we can extend, and we've been training health professionals to perform and to do that.
Interesting. So it's not, we shouldn't just rely on the 90 or so gynecologists that you mentioned in the country. This specialty can be cascaded to other health practitioners. And it's interesting you say this, because a lot of the majority of health professionals are often midwives and nurses. Do you think this is something that, or it should stay within the remit of doctors? Specialized.
As I said, there's what we call medical management of abortion, which has medication that can be given, and the observations can be done by any midwives and to know if this and this. But when it comes to surgical management, then the doctor has to intervene, because this is something which can create some complications. So, but the most important thing is to keep training and keep educating, and if you have people who can master those techniques and follow the guidelines properly, I think this is something which can be done by midwives.
Thank you. Before we get to our next guest, Charles, I don't know if there's something you'd like to share based on what our 2 doctors have shared with us.
I think there's 2 particular things that I want to sort of comment on. And first of all, I think Aflodis mentions a very, very important point, that it's a huge stride in the right direction that we decriminalized abortion, irrespective of circumstances under which it can be deemed criminal or not criminal. I think by virtue of the fact that we have the circumstances under which it was decriminalized is a huge step in the right direction. The second thing is, from a medical perspective, is that by virtue of the fact that we've provided for circumstances under which we can, as a society, as a country, as a medical and legal fraternity, abortion is permitted, is also a huge step in the right direction, as Dr. Goga said. I want to imagine that if we have taken those two strides, and Dr. Goga has alluded to medicinal ways in which abortion can be done without going through a surgical procedure. And herein lies, I think, one particular issue, as far as I'm concerned, that still needs to be addressed. That if you do not necessarily have to go to a doctor or a surgeon for an abortion to be conducted, do you have an option to walk straight into a pharmacy? I think there's a huge debate that needs to be had around affordability of just being able to walk into a pharmacy and either it may be very early in the stages to just buy affordable morning after pills, or even if it's a week after, or you've missed your periods, and you don't have to panic because you can afford to actually
get the pills that induce abortion.
Yes.
I don't think it's the morning after pills, but yeah.
No. I know there's a difference. I know there's a difference. Yeah, I mean
Okay.
that's why I said if it's weeks or after.
Yeah.
But if you are in your unsafe zone and it's happened, you first of all, you should not be shy about it. You should not be embarrassed about it. I've had stories of you go into a pharmacy and you're being asked 1 million questions as to why you want that to buy a morning after pill. I know in villages, this is a bit digressing, but they also ask you why you want to buy condoms. Yeah, but it happens in urban settings that you're being asked why you need a morning after pill, depending on if you find your grandmother's age mate who's on duty.
Yeah. Definitely, we'll be coming back to that. I think one issue, we can't have this conversation without talking about access to contraceptives, especially to young people. Because ideally, I don't think abortion is in terms of government of Rwanda, even giving these caveats or these grounds, I don't think that's like our go-to solution. But ideally, we should be talking, an abortion is the last resort, really. But ideally, we should be talking about access to contraceptives, especially amongst youth. My next question goes to Chantal Umuhoza. Great to have you on the show. I've been watching your work for quite a while now. And, you've been an advocate for women's reproductive rights, I think, for almost a decade or even more. Correct me if I'm wrong. And, each year in Rwanda, numbers show, and these are numbers from around 2-3 years ago, that around roughly 24,000 women and girls need emergency medical treatment from unsafe abortions in Rwanda. This is on an annual basis, and these numbers have since grown, I'm very sure. So as an activist who's been promoting women's reproductive rights for quite a while now, what do you think of the 2019 Ministerial Order? And in your opinion, do you think more needs to be done in terms of ensuring safe abortions when it's a woman or a girl's last resort, to ensure safe abortions in Rwanda? Over to you, Chantal.
Thank you. Yes, indeed, for me it's been more than 13 years me working on this topic, working with other different partners that have been working on this. I do remember it started way back in 2008, and obviously from where we are now with the current ministerial order, there's been a lot of progress. There's been many changes. If I really recall how things were at the time and where we are now, I am happy. I'm really happy that there's been some changes. I'm happy that access to services has been extended, at least to some extent, and more women than ever than how things were before are able to access services, life-saving services, health services. And it's something that I really feel good about, and really also want to appreciate that the government and other stakeholders have been able to take this on. So yeah, so the ministerial order is, it's still, I would say, it's still new. the implementation that has been going on, like, in Rwanda, when the law is passed, like any other laws, it takes a while for people, for service providers to really get to understand. And thanks to people like an organization like HDI and other organizations that are really doing a lot in terms of sensitization and making sure that people really know, because people can't, a law can exist, but if there is no awareness, people will still, assume that nothing has changed. And even with what these different organizations are doing, including myself, there's still many people, many Rwandans, many women and girls that don't know about the changes that have happened. I meet many quite often, and sometimes we hear of the different stories. So this means that there's still unsafe abortions going on. Women and girls are still decide or resort to unsafe measures to terminate pregnancies. And so that's why I think even at the facility, at the health facility level, they're still dealing with a lot of post-abortion care cases. And there's been a study that has actually been done to really show the cost in terms of what the health sector has to budget for, or what it costs for the health sector to actually treat complications resulting from unsafe abortion, and it's a lot. It's preventable, and that's why through awareness it can be done. One thing that I also really want to talk about is how it's something that Doctor talked about, is the importance of decentralizing this service. It is possible, it is feasible, and it is the most important thing that can be done given the context. We do not have enough doctors, that is a fact. And I don't see that changing in the coming, 2, 5, 10 years from now. So that is the context that we're dealing with. There are many Rwandans whose first contact, or their only contact in terms of health services, is a nurse. And maybe they will never be able to face a doctor. So this is a health service that can easily be managed at the lower levels. And like it was explained, if there are cases that need extra care, this can be referred, because Rwanda has a really strong health reference system, and we're well coordinated. So I believe this can be handled, but at least we need to decentralize the service, and it's feasible. Other thing I want to talk about is how there is still stigma. There is still social culture norms associated to this, and this will always be there. They're not going to end anytime soon. But in the meantime, we also have to make sure that service provision and health facilities are aware and also respond in a way that recognize that this stigma still exists. I want to give a quick example of how, for instance, women and girls who go for abortion services sometimes are put together with women in the maternity leave, and there's still stigma there that they face, where there is still people in terms of the service provision, but also other patients that may really discriminate against them, that may really cause some harm to them in terms of what the kind of verbal attack they may get while they're getting the service. So we also need to improve the facilities that we have to make sure that even the cases of women that need to access services can still be able to get that with dignity and with quality. And so that's also something I really want. So there's still more that needs to be done, but for now, this is what I want to share.
Thank you. Thank you so much, Chantal. That's a very important point on decentralizing these services, like Dr. Goga actually mentioned earlier on. I just want us to talk about, the next part of the conversation before we go back to our Twitter feed. To do with perceptions in this country. We cannot be here on the square and we're not talking about perceptions, whether it's religious, whether it's cultural, whether it's even personal, and these perceptions don't have to be with people who you think may be progressive thinking or educated. Everyone has their own opinion on this. And I'll start with you, Dr. Kagaba, because, you're here on behalf of the civil society. A lot of your work is working with communities and people and leaders, religious or cultural or local authorities. And Dr. Kagaba, if you could just tell us, after this ministerial order has been put in place, the benefits of it, especially when it comes to women and girls who can now have safe abortions instead of the alternative, which has been the norm, for a very long time. What is the perception, on the ground? How are people receiving it, and what are some hindrances, or how You know, just for the sake of our viewers and for the sake of our panel, HDI working with communities, what is the perception and reception of this ministerial order and abortion in general in the country?
Yeah, as I said, the ministerial order getting to this level and then coming from a very almost 10 years of discussions, conversations, of course, safe abortion has always been there. It was a reality. So we were losing a number of women who were trying to procure unsafe abortion. And that was a huge challenge to the advancement that we want to see to save women. We want to see no woman dying or girl dying because of unsafe abortion or procuring unsafe abortion. When it comes to the perceptions, it's something that is a process. I remember in the first days, 2010, when we were even inviting people just to have conversations on what should be done, people were boycotting meetings just by putting abortion on the invitation. And we had to find a way of branding the meetings as sexual reproductive health rights meetings, but you don't mention that. People were not even ready to take a step to understand what is this animal in the house in terms of unsafe abortion. Myself being a physician, I remember the first time someone approached me to say, HDA, can you look into this? I mean, I said no categorically because I thought I still had the same perceptions. We've done some studies looking at perceptions of counselors. We've looked at perception of women. You can still see that we have very courageous women like Chantal who can talk about this. But when it comes to getting women talking about unsafe abortion and the need to change, it was very difficult in our context. I actually remember in 2012, I think for the first time I haven't seen it, when the bill was passed in Parliament, allowing the 4 conditions of incest, rape, forced marriage, and reasons related to health. We had 7 female members of Parliament categorically denying the passing of the law and coming out to say they are against the law. I mean, so there's a lot of perceptions on this abortion. Dr. Goga knows when we are training doctors, I think someone has tweeted about it. The doctor is saying we can't provide termination of pregnant services. And it has happened in some other countries. They call it consensus objection, where someone may refuse to provide a service because of their belief. Because I don't believe in abortion, I can't provide abortion. But what is important to retain is that as much as you may want to hold on to your beliefs, you can't deny someone a service. If you can't provide a service, you have an obligation to refer to someone else who can provide safe services. So it's not acceptable that in a health facility, all doctors would sit and say, we're not providing safe abortion. That would have to go through the patient's rights law that we have, the medical liability insurance law. People can be taken to court. And interestingly, you've seen that Rwandan society is increasingly getting to know about their rights. We've had doctors being sued for either providing services that are not accurate, they're not quality services. So these are things that we expect. So we expect that people, we have to keep conversations going. I can personally attest that people's perceptions change. And actually, when you see today, when we are having this kind of conversation, the way it was 10 years ago, I'm sure if you go to Twitter and see how people are responding and giving comments, you'll find more of a balanced opinion. People have understood that unsafe abortion is there, and we need to get to provide the right response. And that's why I'm happy that the changes that we have seen have happened. And I want to come back to the question you asked, Chantal. Should we have more changes? Yes, I think we need more changes. We need to see task shifting happening. As you know, most women in Rwanda, their first level of access is at the health center, which is today staffed by mainly nurses and midwives. We don't have doctors at there. So the more you take it up, you're denying a service. And these same nurses and midwives are handling delivery. They're handling women who are pregnant. So maybe they can be allowed to do medical abortion, which is the pill that you would give, which is medication. And maybe they can refer. So we have to do this. The other thing that we have, which is a challenge, is around the use of community-based health insurance. At the moment, the law establishing community-based health insurance requires that if you go to a hospital, you need to have a referral from the health center. So it has to be that referral. But then we said in the ministerial order that women who need safe abortion can go to any health facility. So it becomes challenging for them to access services using Mutual if they have no referral. So we need also that to be harmonized. In the ministerial order, we talk about the health facility which is allowed to perform services, and we say it is a health facility that has polyclinic level. Polyclinic means multiple departments. I do think a gynecologist who is very experienced, who decides to run safe abortion services with only one department should be allowed, because the moment we keep creating other additional barriers, we are limiting some additional women. But nevertheless, we are very much appreciative of the process. We have seen change happen, and we're hopeful from the conversations we are having, from the doctors we are training. We also have doctors whose perceptions have changed, who are willing to provide safe abortion. Just the other day when we were celebrating the International Day Against Unsafe Abortion in Ruhango Hospital, Kinazi Hospital, they confirmed they had given services to over 50 women who had come for safe abortion. So increasingly we're seeing a lot of change, and we'll keep dealing with perception. We have to organize value clarification trainings with everyone, with the communities, to ensure that we respond to the main problem of stigma. Stigma is still a huge issue. Yeah.
Thank you. Thank you very much, Dr. Kagaba. There's lots of tweets that are coming in that we'll definitely be reading out. But I want to take the question, before I go to Chantal, to Dr. Ngoga. You know, what is the perception? You know, we had a tweet coming in from one of the people saying that there are loopholes in this ministerial order because it doesn't indicate that the doctor has a right to deny this service. What's your take on this, and how would you deal with medical, people in the medical field having this opinion when someone comes to ask for this service?
Yeah, sure, we still have issues, perceptions. Doctors also, or health providers, they come from the community. So there's some thing we see in the community, we're still seeing in the health providers. But a good thing with the health providers that we live this situation on a daily basis. So one of the things which pushes us to understand better the situation is when you see people coming after unsafe abortion, and you have to spend the whole night operating, go in the abdomen, found a uterus which is completely necrotic.
What does that mean?
It means the uterus. Sometimes when they go on for this unsafe abortion, they use so many things which are not clean, and I don't know what they use. And then sometimes they can perforate the uterus. And if you perforate the uterus, the infection will come in, because it's something they are doing without telling others. They try to keep it for themselves until they get too sick. And once they get too sick, they cannot go back to that person because he's not qualified to do that. And at the end, they come to the referral hospital, which is one of where I work in a hospital which receives patients like this, and they are terribly sick. And most of them, they die, actually. So, and if you're lucky, maybe we'll remove your uterus forever.
A hysterectomy, basically.
Yeah, hysterectomy, and that's to start to try to save your life. So you can have the perception today, but after seeing those cases, I think it will change. It will change, because you say we cannot continue like this, we need to give the service, because if you deny the service here, we can do it in a correct manner, so this person will go to look for it somewhere else. And at the end of the day, he'll come back to you, and you cannot even save the lives of these people. So, responding to that question from the doctor who was saying that maybe the ministerial could have mentioned that, I don't think it's a good idea, because first of all, when we study medicine, our first role or primary mission is to save lives. So that's what we do, unless you can't do it. So maybe you have different type of skills and all that, but you'll never tell a patient that, okay, because I'm believing in this, I can't do it. When you
Isn't that what you call your Hippocratic oath?
Yes, Hippocratic oath. So you have to come to rescue of any patients in danger, and actually the law is clear. If you don't do that, you can be punished. So it means that if you feel that you're not able to do that, at least you can help the patient to access the service by other means. The easy example to understand is that it's like joining army, and you say, I cannot shoot the enemy, because I believe killing enemy is not right. So at that time, I can say that you're in the wrong place. So a doctor who's there to treat patients, to save lives, if he can't do it, and I think he's in a wrong place. Not in the wrong place.
Not in the right place, absolutely.
We need to help the patients as much as we can. Of course, as you said, the primary intention is not to do abortion all the time. I've seen, we have some preventive measures which can be taken.
Yes.
But unfortunately, the situation is such a way that these unwanted pregnancy, they are there. So we have to educate, use family planning or contraceptive. But as long as we have these cases, we have also to provide a safe environment so that we can avoid mortality for nothing.
I want to go to Chantal very quickly before I come to Charles and to our Twitter feed. Chantal, what is your take on perceptions? You've also been close to the ground, probably attending half of the conferences that Dr. Kagaba mentioned, where people would even boycott them. We've seen them in women parliamentarians. Just because we have a majority of women parliamentarians doesn't mean they would endorse things that some people think they would. I don't think it's correct to assume these things. What's your take on perceptions, especially with regards to, I would like your follow-up response to also do with availing contraceptives to youth.
Thank you. Well, it's deep-rooted, like I said before, in social culture norms, traditional, religious, how socialization in general, how people are brought up. And this shapes what people value, what people call right or wrong. And everybody has that, doctors and others alike, so we're part of the society and those exist. I do remember in 2008, when I started publicly talking about the need for safe abortion, I was attacked individually. And that was a reminder. I already knew the context I'm operating in, but it was a reminder that it's a context that I need to be aware of, and I have to consciously operate and address these issues as I go. So I also reflect on how, when I was starting to work on advocacy for abortion, one of my first work that I did was to visit women and girls in prison who had had abortions. And my objective was to collect personal stories with the idea that these stories can be able to change people's mindsets, because the mindset is we're dealing with bad women. We're dealing with women who are considered bad or not aligning with what we call good. So I wanted to show the Rwandan society that sometimes what we have in mind or what we assume might not be correct. And with that, I do remember that as part of the collection of the stories, it also showed me that the first people that usually report cases to police when women have abortions includes their mothers, includes their sisters, includes their very direct relatives. So it really also showed me how the stigma and the perceptions of this issue are really deep-rooted to the extent that your own mother can report it for you to go to prison, because they strongly believe that what you're doing is not aligning with what they believe in. So it is not really a surprise, even with among the political leaders, women or not, that these exist. And like I said, these are not issues that cannot be changed in a short time. We need to continuously work on this as we go. But in the meantime, the services are needed. And what I really want people to understand that, like Dr. Goga said, this is about saving lives. At the end of the day, like we said, denying the service does not mean that the women will stop. It just means that you're making it unsafe. So we always have, like for instance, some of the discussions I've had when we're conducting what we call the value clarification workshops with service providers. By the end of the workshop, they feel like, okay, I don't agree with that. I don't agree that it's a right. But when it's about saving the life, I think I can do that. And that is at least the minimum or the basis or the best we can at least have among the service providers. At least do understand that it's about saving people's lives and trying to understand that you're trying and contributing to making sure that unsafe abortions can end, because the services need to be provided. Leave the moral judgment. Leave the whether it's right or wrong to the woman that have decided to do that. If you strongly believe it's a sin, leave it to the God to be the judge and to be the one to do what is right, to do what has to be done, if it's punishment or not. Do not be the police. Do not be the judge. Just do your job as a service provider, and then leave the rest to the woman, because at the end of the day, no one can claim to be perfect. So, yeah.
And just lastly, what's your take on availing contraceptives to youth?
Yeah, so like when we're talking about abortion, it's inevitable that we also need to talk about access to contraception, because abortion is not ideal. No one wants to ideally be going for abortions more than one or twice. So it is something that needs to be done as a last resort, or if it has happened. So, and the first step is always prevention, and prevention for unsafe abortion or abortion at all is prevention of unwanted pregnancies, so contraception. So with the daily increase of teenage pregnancies and discussion on this topic, I think at this rate, most of the Rwandans are really well aware that young people, young women and girls in Rwanda do have sex. That is the reality. So, but what we haven't accepted, as we see, is that we do know that they have sex, but we're also not accepting that they should have access to means that help them prevent unwanted pregnancies. And this is also related to the social cultural issues, norms, and perception on this topic. Because once you accept that they can have contraception, then you are really accepting that they are sexual beings and they are having sex, which is something that most of the Rwandan society members haven't yet gotten to accept fully. But contraceptions are needed. If anyone is sexually active, and I think we have statistics that show that in Rwanda, that the age of first sexual consent is, 14, 19? 14 for boys, I think, and lower for girls. And that means that if people are sexually active, then they have to have means to prevent pregnancies. Otherwise, if you don't do that, then we're just creating a situation that will, will increase more problems. Unwanted pregnancies result into unsafe abortions, but it also impacts young people in different ways in terms of dropping out of school or just impacting their lives in general in different ways. So access to contraception, for me, it's not something that we should even be debating until today, because it is clear that this is something that is an urgent need and needs to be done.
Thank you. Thank you, Chantal. I know on the square we've had this discussion multiple times, because it's something that it has an economic impact in terms of in our future generations, teenage pregnancies, unwanted pregnancies, and the numbers keep on spiking. The numbers are alarming. And I think sometimes, Charles, the numbers, when we have these discussions in the square, either people are desensitized or we're just taking it as business as usual. But the numbers, at least in the last 5 years, from 2017, have been going up. And the pandemic also last year did not help, the lockdowns and that sort of thing. But we have unwanted teenage pregnancies. We've seen the economic impact it has on the life of just one teenage mother. Her child is bound to be a teenage mother. It's almost cyclical, so to speak. And either we get our heads out of the sand and understand that these young people are having sex, the least we can do is just provide them with the tools, the knowledge, and the access to contraceptives that will at least try and just put a dent into the issue. It's a nationwide issue, actually, that is teenage pregnancies. But Charles, I'd also like to hear your thoughts before we go to...
Chantal really hammers it on the head, and whether we like it or not, the churches, the schools, and all these extreme sort of organs, the mosques and what have you, they need to understand that the youth are having more sex than married couples. Now, are they going to change that overnight? Definitely not.
Yeah. So,
deal with it. We should find ourselves in a situation where you walk out of Zion Temple and you go to the washrooms and there are free condoms there. Because and we're not about to change it, because the sooner we accept it, the better it will be for us. You need to go to secondary schools, probably even today, primary school. By the time you're finishing your primary school, and I think on the show here, one of our previous shows, somebody did allude to the fact that our Rwandan bodies may express themselves more loudly at a young age, and you'd more likely find somebody who's 12, 13 years old looking like a mature girl or boy for that matter, and it may lead to temptation and what have you. So it's a fact of life, and we have to confront it. That's one point. But Dr. Flodis gave us an example of where they went to celebrate the World Anti-Abortion Day. I think that's what he called it, in Ruhango. Now that might give you an impression as if it is a remote area, and therefore this is a third world problem. Today, the U.S. Supreme Court is ruling itself against, I think it's called the Roe versus Wade case, and it's become a very global subject. Now, if the world's first world country has divergent opinions on this matter of abortion, now imagine yourself with Ruhango people. Therefore, the point I'm really raising is that we have a long way to go, and we should not tire. Medically, politically, socially, religiously, we're not about to win this one. However, we probably need everyone to go through Chantal's activism and what have you for us to appreciate this. You know, I belong to a lot of WhatsApp groups, and on one particular group today, somebody asked, why are we even discussing abortion? The right to live when we lost 1 million people. Somebody thinks that we should deprive, you know, people of living, yet we don't have people. So we have a long way to go. We should not tire, and it's the more we continue pressing that people should have safe abortions, the better for all of us. Yes,
absolutely. I'd like us to go to a Twitter feed. We have a couple of tweets coming in. And I'd like to have the first tweet on our screen. This tweet comes in from Andrew Kazivge, who says, I'm afraid the church is not at peace with this, but what possible remedies does it have to offer situations of emergencies like rape or forced marriages? He's throwing the ball back in the court of the church, so to speak. We also have another tweet coming in from Rwanda Health Magazine that says, having an abortion is very safe and there should be no doubt about it. But people seeking abortion are not told about short and long-term effects on their health. Although there are chances of complications, such as damage to the cervix during surgical abortion, why don't they tell? I'm not quite sure what Rwanda Health Magazine is trying to say, but we'll try and clarify that later on in the show. We have another tweet coming in from Being, who says that, how about putting more effort in preventive care? Safe sex, condoms, no sex before marriage. It's sad to kill a potential president. Like you said, Charles.
No wonder they have an anonymous name. How do you say there's no sex before marriage?
Anyway, like we said, divergent views, totally divergent views on this matter in Rwanda and also in the world. We have another tweet coming in from Edward, who says, we appreciate the great work being done by HDI in the creation of awareness on a range of health issues affecting our society. Your labor isn't in vain because people's mindset and perception is visibly changing. Thank you to The Square for the good topics on your usual weekly show. Thanks very much from Edward. We have another tweet also coming in, if I could read that. And this is from, I think, Dr. Magnifique. If you could have that on our screens. And Dr. Magnifique says that, thank you, The Square, for choosing to discuss this important topic. The population needs to know about safe abortion. We have witnessed so many avoidable deaths or major serious complications with people that are allowed by the law to access the services. Indeed, I think Dr. Magnifique echoes, you know what you said, Dr. Goga, you've seen avoidable deaths, you've seen avoidable complications. You know, young people, or, you know, just having hysterectomies and that sort of thing. And we have one tweet coming in, if you could have this on our screens, from Miduji, who says, it's a matter of life and death. Almost all grounds for legal abortion in Rwanda are a result of social or moral failure. Giving the victims access to abortion services is the least we can do. I can't agree more with Miduji. We've come to the end of the show, and I'd like to just hear closing remarks from all our panelists on this very important topic. I'd like to tell our viewers to just keep the conversation going using #TheSquareRW. But I would like to hear closing remarks, and I'll start as briefly as possible with our guests. I'll start with Dr. Kagaba, Chantal, and then over to Dr. Ngoga and Charles. Briefly as possible, over to you, Dr. Kagaba, on the way forward.
Yeah, I believe that the progress that has been made is very significant, and we're in the right direction. We need to keep taking further steps to ensure that no one is left behind, and knowing that as a country, I think we have chosen the advancement of women's rights, and if we keep getting the right information to people, we'll be able to prevent certainly abortion, because as everything is connected, when we're talking about contraception, and we are not availing it as well, and we are having challenges to prevent unwanted pregnancy. It then leads on safe abortion, and safe abortion leads to loss of life or other complications. So I think all these things are interconnected, and we can't get one size fits all. We need to keep looking at all the measures and ensure that we remove all the restrictions, because as a country we are thinking for everyone, and we are committed on our side to continue these conversations. I want to thank everyone. I know Dr. Goga and his organization are doing a lot of work in training doctors. We are hopeful that the ones that are being trained will be able to provide friendly services, and eventually will be able to reduce all deaths that are resulting from either lack of services or lack of access to information.
Thank you. Thank you very much, Dr. Kagaba. Always a pleasure having you on the square. Chantal, over to you, closing remarks.
Yeah, I really think like one of the person on the tweet said, when a woman, or let's say a young girl, gets pregnant, unwanted pregnancy, it is a sign that we have failed her as a society. We have either failed her without providing the right information and guidance, or we have failed her in other different ways because we also have persisting gender-based violence. And I want to emphasize on this because we are also during the 16 days of activism against gender-based violence period. So there are many different things that really shows that we still have many deep-rooted issues that we need to address, that especially those that violate women's rights in different ways. And so, like they said, provision of these services, safe abortion, is the least that we can do. And at least let's do that, and let's do it right, and let's do it for every woman and girl that need that. For me, my vision beyond this, beyond what we have so far in Ministerial Order that I really appreciate, is a situation where we can also be able to get to home-based care for abortion services, for medical abortion, for instance. We have health facilities that deal with diverse health issues. Medical abortion in different other contexts has gone into a level where it can be self-managed and can be done by women themselves in their homes, in the comfort of their homes, and not until they need, the services of a medical doctor. I believe that we'll get that point because this also, in a way, will be reducing the burden or the pressure from health facilities that we have. Also the burden from the health providers that we have in the country that are still not enough. So I also envision that we can be able to get there. So far, I do appreciate and I want to keep contributing to this debate, but we will keep working on this until we know that every woman and girl can be able to access safe abortion safely and anywhere. Thank you.
Thank you very much, Chantal. Thank you very much also for coming to the show, and we hope you'll be a regular guest, especially on topics like this that you so actively keep on promoting and sensitizing people on. So thank you very much for that, Chantal. Dr. Goga, very quickly, closing remarks.
Yeah, what I'll say is, and maybe the show is that for the health providers, I think nothing should stop us providing this service to those in need. The law is very clear, it's protective. So I think in the past people, they also have fear that they'll go to court when they provide this service. But today the law is very clear and no doctor should be taken to court as long as the one who's requesting for the service has signed clearly the consent form. That consent form is there to protect the doctor. The second thing is just to tell the public that it's better to have this service in a safe environment than going under trees or beds or whatever to get unsafe abortion because the complications are so huge. At last, I think we'll continue educating our people, health providers, increase awareness as well so that this service can be increased and access to safe abortion can be given. So we don't want to hear any more unsafe abortion.
Thank you. Thank you very much, Dr. Goga, especially coming from you on behalf of RSOG and the medical fraternity in general. Charles, closing remarks?
Yeah, I mean, just to echo what everyone has said, I think it's comforting that we're talking about abortion. And to me, that's really the highlight of this. 5 years ago, would it have been possible? Probably not. So let the HDIs of this world and Chantals of this world now deliberately go to those areas that are very conservative, because that is where actually I believe that the issues are, the churches, the schools, and what have you, and preach it on, because you don't choose when or when not to become pregnant. you don't choose, and I think there's a very, very pertinent point about boys getting away with it and girls taking the brunt of it, and even though there might be an argument about being comfortable being in a patriarchal society, we should not accept it. Boys get away with it, we should not be unfair to the girls.
I agree.
Yeah.
Thank you very much, Charles. It's always a pleasure having you. Dr. Goga, always a pleasure having you. To our guests, if you could have them on our screen once again, Dr. Afrodis Kagaba and Chantal Muhoza, it's been an honor having you on the show.
Thank you.
Thank you so much.
Thank you very much to our viewers. Keep the conversation going on our social medias, whether it's Twitter, Facebook, or Instagram, using #TheSquareRW. Thank you to our partners, Uzi Collections and Bourbon Coffee. It's always a pleasure to host the show and also tackle very, important topics in Rwanda. Thank you very much. Have a good night. See you again next week.